My name is Jonathan Fhima, and today we'll introduce you PVBM, a Python Vasculature BioMarker Toolbox based on retinal blood vessel segmentation. So let's dive into the introduction. Blood vessel can be non-invasively visualized from digital fundus images. So digital fundus image is what you can see in figure 1 in the left panel. Furthermore, we know that it exists a relationship between abnormality in the vasculature in your eye and some cardiovascular pathology of a patient. And recent advances in computer vision shows that it is feasible to automatize blood vessel segmentation in GFI. So for instance, in the right panel of the figure 1, you can see some manually arteriovenous segmentation from the GFI. We think that in close future it will be possible to do accurate and reliable automatic segmentation of the arteriovenous based on the GFI. So that is why we want to push our research one step further and to start to compute some biomarker based on the segmentation. So from now we compute 11 biomarkers that are included in our toolbox PVBM. PVBM aims to enable large-scale analysis of the retinal blood vasculature network in a fully automated manner, introduce new algorithmic method to estimate the tortuosity and the branching angle, and enable reproducible research through open source PVBM. Let's go into the method. So a total of 11 vasculature biomarkers were implemented in PVBM, and we compute them separately for the arterial and the venous, and we benchmark them against some implementation when we find some of them for some of the biomarker, of course. So this is the biomarker we have computed in table 1 with sometimes some visual interpretation in figure 2. So there is the of area, so which is the area of the blood vessels, the length of the blood vessel for the of length, the perimeter of the blood vessels for the of pair, the number of endpoints for end, the number of intersection points for inter, the median tortuosity for tor, the branching angles for BA, and some fractal dimensions, so D0, D1, D2, and singularity length. We also use the database to perform glaucomatous versus non-glaucomatous statistical analysis of our biomarkers. So this database was provided by the UC Leuven Hospital in Belgium. It's composed of 69 patients, 50 with glaucoma, 19 without glaucoma. And let's go into the result part. So PVBM was benchmarked against some existing software implementation when the biomarker implementation was available in some software. So you can see the result in table 3. We have really low difference when the biomarker was available. Also, in table 4, you can see the significance of the glaucomatous experiment. So most of the biomarker was shown to be significant to distinguish between glaucomatous and non-glaucomatous patient. And in figure 3, you can see some example of biomarker computed for one normal patient and one glaucomatous patient. So let's go now into the discussion and conclusions. So we developed PVBM, fully automated Python Vasculature BioMarker Toolbox, and it will be available open sourcely in physiogeo.com. We benchmark them and then again some implementation in ImageG plugins. We demonstrate how PVBM could be used to analyze and characterize vasculature network in glaucoma versus non-glaucoma patients. And the new resource enables reproducible and large-scale analysis of the vasculature network in disease affecting the eye. Future work will include the development of an automated arteriovenous segmentation algorithm. Thank you for listening.